everybody, and welcome. Thanks so much for joining us today for the NIHR Research Support Service Research Methods Academy seminar. We're really excited today to be talking to you about how we can improve patient and public involvement in statistical methodology. My name is Lottie. I am the scientific coordinator working on the Research Methods Academy. I've just got a couple of quick housekeeping notes before we get started. We are recording this session for those who cannot join live. And if you have any questions for our speakers, can you please put them in the Q&A pop-up at the bottom of your screen? And remember to upvote the questions when we get there. So we will be answering the questions with the most votes. Given that there's quite a few people already joined, we might not get the chance to answer all of them. The chat is also free to use. You're welcome to say hello and to introduce yourself and say where you're from. We're really interested in finding that out. And finally, please look out for some feedback links. This is a new series and we want to continually improve. So if you see a feedback link, please complete it. Now, I am delighted to hand over to my colleague, Jane Wilcock, who is the chair of this session. Jane is also the National Strategic Lead for the Research Methods Academy and is also a research fellow at UCL in the Primary Care and Population Health Department and is a senior methods advisor at the Imperial College London Partners Hub. And we're here at the London Hub to bring the Research Methods Academy to you. Jane is a specialist in qualitative research and a fantastic expert to have chairing this session. So thank you, Jane, and over to you.
Thank you, Lottie. I'd like to extend a warm welcome to you all to today's seminar. I'm going to provide just a brief introduction to the National Institute for Health and Care Research Support Service, our NIHR RSS. So our service provides extra support through experts and advice to applied health, public health and social care researchers on the design and delivery of research. We're a national service and researchers can access the most appropriate support irrespective of where you're based. Our Research Methods Academy, of which this seminar is part of the series, is coordinated by the Hub at Imperial College London and Partners. And we're focused on innovation and best practice in diverse research methodologies. So our key aim really is to move methods from theory into our own practice and deliver meaningful impact for people and communities. So I encourage you to sign up to our future seminars. We have a schedule of varied topics for next year. And as Lottie mentioned, we'll be collecting a little bit of feedback at the end of today's session. And do feel free also to share with us any suggestions you have for the series going forward. So I'm delighted to introduce our speaker today, Professor Laura Gray, who's part of the Leicester Biostatistics Research Group. Laura is an advisor for the RSS Leicester and Partners Hub. She's a leader in cross-disciplinary research that bridges the methodological and clinical areas. She has a particular focus on the identification, prevention and management of chronic and multiple long-term conditions, especially through the design, development and testing of complex interventions. Laura's methodological work is driven by real-world challenges encountered in supporting applied health and social care research today. I'm delighted that Laura is going to present us with some considerations for involving people and communities in methodological research. Laura, I hand over to you to take it away.
Great, thanks Jane, thank you for that introduction. And thank you everyone for coming. It's so nice to see, well, nice and slightly daunting to see the number of attendees creeping up as you were all joining. So I'm going to talk about PPI for methodological research today, focusing on statistical methodology, but hopefully there'll be lessons for those of you that aren't statisticians as well. So I hope I'm talking to the converted, but just to make sure we're all on the same page. So what is patient and public involvement? So this is research with or by members of the public and patients rather than research that we do to, about or for them. So this is including members of the public as members of the research team, that kind of active involvement that actually shapes and drives the research rather than being participants. And what do I mean by statistical methodology research? Well, this is research about how we do research. I asked my friend ChatGPT to give me a definition, and I think they summed it up quite well. So statistical methodology research is a field of research focused on developing, improving, evaluating, or comparing statistical methods that are used to design, conduct, analyse, or interpret data from research studies, which I think sums it up quite well. So it's looking at the methods we use as statisticians and trying to improve those methods. And I've just got a couple of example papers on the screen. You can see one that's comparing approaches for handling missing data using a simulation study. A simulation study is an approach that we use quite often in methodological research. This is where we make artificial data that has known properties, so then we can compare methods to see which one gets closest to the right answer. You can also see an example that's looking at a particular design for a clinical trial. So statistical methodology not only considers how we analyse data, but how we design studies. And more as statisticians, our methodological research is thinking about how those methods get implemented in practice. So the final paper you can see there is an R package. So it's really important to have accessible ways that people can implement the methods that we're developing. So programming is also part of the methodology to drive forward the field. So I wanted to just get a feel really for how you see PPI and methodological research. So when you think about trying to conduct PPI in a meaningful way for methodological research, whether that be statistical methodology or another type of methodology, what comes to mind? What's the first thing that you think of? I thought it would be really useful just to get a feel for how you see PPI for methods research. So if you scan the QR code on the screen or use the link which Lottie has put in the chat, you should be able to enter a word, and then in a few moments time Lottie will present that word cloud to us and we can see what comes to mind when we think about bringing these two methodologies together.
Thanks, Laura. I'm going to start sharing my screen because my screen's going crazy with people's answers. So I'm just going to take control. And can everybody see my changing screen?
I can't. Do I need to stop sharing?
Potentially. Maybe try, yeah, maybe try that. There we go.
Aha, yes.
Thanks, Gareth.
Great, so let's have a look at, so a big word, difficult, yep, challenging, complex, and then we've got some words which are around the sort of methods that you might use, so sort of co-production, thinking about inclusion, tricky, that's a good word. Collaboration, I really like that collaboration has come up. Complicated, accessibility. Ooh. Great. Difficult to combine. An essential marriage, I like that one. I think it's an essential marriage, but we shall see when we get to the end. Okay, let's just have another look. I like that someone's just said how. Hopefully I can help with that as the talk goes on. Hard to navigate. Trusted relationships, that's really nice, really important to develop those. Unsure, yeah, I think that's where I started. Okay, that's great. It's really nice to get a feel for how people in the room feel about methodological research and PPI. So thank you for that. So I'm going to take you on a bit of a journey with me about how I've become really interested in how we can do a better job at doing PPI for methodological research. And this is really the start of my journey, which happened quite late on in my career. So I've been a statistician for a long time, but my first sort of go at doing PPI for methodological research came when I was applying for the NIHR Research Professor Award a few years ago. I'd been sort of involved on the periphery of PPI that had happened for the applied research projects that I was involved in, but I never actually had to undertake some PPI myself. And I was quite daunted at the prospect. I could see from the applied work that I'd been involved with the impact that PPI could have. And I wanted to do something meaningful and something that actually made a difference rather than just doing PPI for the sake of doing PPI because I needed something to put on the application form. And to be honest, I was a bit scared, anxious about undertaking PPI to inform this methodological research. So I did quite a lot of looking on the internet to find other examples of where people had undertaken PPI activities in this space. And I didn't actually find that much out there to guide me. There's more now, which is great, but at the time there wasn't a lot out there. So I did get through the process. You can see one of the slides here. I was trying to explain to the PPI group I was talking to what I intended to do sort of pictorially. And I think my PPI did go well. It was appreciated by the panel, although they didn't give me the award, which was quite sad, but not unusual. But this really sparked something in me that I wanted to sort of try and do a better job of PPI going forwards, improve my skills, but also maybe try and improve things for the researchers working in the biostatistics group at Leicester, but also for wider members of the statistical community. So the first thing I did was to ask the biostats group at Leicester, we're a methods group, so we're all undertaking methodological research, if anybody fancied getting together to sort of brainstorm how we felt about PPI and think about how maybe we could do a better job as a group. And actually about 20 people turned up to a meeting and we're only a group of about 30. So I was really pleased. And lots of people were feeling a bit like I was feeling. They were nervous, they felt inexperienced. They were worried about how to convey the sort of complex or technical nature of what they do in accessible language. Some members of the team, their methodological research didn't have a specific clinical application, so they were unsure of who to speak to. There were difficulties around the logistics, so accessing PPI groups, funding PPI before you've actually got funding to develop your application. Lots of issues around payment. Some people had tried to do PPI in the group and then just found the bureaucracy around trying to pay the people who took part so difficult that they gave up. And nobody wanted to do anything that felt very tokenistic and like we were just doing PPI for the sake of it. So we decided to try and work together to see if we could improve both our skills, but maybe also develop resources that might be helpful to other people. So we've got a poll now. So it'd be really nice to know. So have you ever undertaken PPI or been a public contributor for a methodological study? So there's 3 options there. Yes, if methodology, and a yes for another type of methodology, or no. And then the second question is, how confident would you feel undertaking PPI or being a public contributor for a methodological study? So it'd be really great to see the experience in the room and how confident people feel within this space. So we'll just give you a couple of moments to get your answers in.
Hi Laura, it's popped up on everyone's screen. So should we give it another 15 seconds, so 1 minute for everyone to finish?
Perfect.
Fab. Okay, I hope everyone's got their answers in. I'm about to end the poll. And I'm sharing results.
Great, thank you, Lottie. So in terms of yes, so 14% of you have involved PPI in your statistical methodology research, slightly higher for other types of methodologies. That's interesting, but 64% of you haven't. So hopefully today you might move along a little bit in terms of thinking about involving members of the public in your work. And how confident do you feel? Let's have a look. So very confident, 4%, confident 15%, neutral 33%, unconfident 32%, and very unconfident 16%. Okay, so lots of you are feeling like I was feeling when I started. And actually, I would still say although I have now undertaken quite a bit of PPI within this space, I'm still very much learning. And actually, every meeting I go to is very different. So I would say I'm still maybe at the neutral end of things. Hopefully one day more confident. So thank you for that. So the first thing we did was conduct a survey of statisticians. So we wanted to see did the wider community of statisticians feel like we did at Leicester. And thank you to those who took part in the survey. There might be some of you here today. And of those that responded, just under 80% had not undertaken PPI to inform their methodological research. About half didn't feel confident, and 91% felt that there wasn't enough research in this area. So that really spurred us on to think about what we could do to improve this situation. So the first thing we did was recruit our own PPI group. We did worry that people might not be interested in wanting to take part. And we used the People in Research website to recruit a PPI group. And actually, we were overwhelmed with response and people expressing their interest. So I think the assumption that people wouldn't be interested in this type of research isn't true. We did find the people that we recruited, they'd all undertaken PPI previously, and what they said they really liked was that this seemed an opportunity to grow their skills as a public contributor. So that was a really nice thing to hear. So we recruited 8 members in total to our PPI group. And with them, we thought about what we could do collectively within this space. And sort of 3 ideas came out: developing an animation, putting together some case studies, and developing a glossary. So I'm just going to briefly talk about these 3 resources that we've developed. So our PPI group said it would be really helpful to have an animation that explains what statistical methodology research is in an accessible way. Lots of our public contributors and other public contributors that I worked with during my fellowship, they were really experienced in supporting applied health research projects. But when they came along to one of our meetings, it took them a while to work out what we were talking about and how methodological research was different to applied health research. So our PPI group thought it would be really helpful to have an animation that could be sent to public contributors beforehand so that they sort of know what to expect when they come to the meeting. And they can also judge then if this is going to be something that is for them. They also said we needed to really make it clear why PPI was important for this type of research, because it wasn't immediately clear to the public contributors why their input was important once they knew what statistical methodology was. So we co-produced this animation. It's available on our website and on the Learning for Involvement website. So please do go and have a look and use it when forming your PPI groups, and do let us know how you find using the animation. So that was the first thing we created. Our PPI group then said to us, well, that's great, but I still can't see what this looks like in practice. It would be really useful to have some case studies that introduce methodological projects and show how members of the public have impacted those projects. So we've then developed a number of case studies based on the PPI activities we've undertaken at Leicester. And we've disseminated these in two ways. So we've created short animations, and these were developed with public contributors in mind. So they talk about the projects, the methodology projects that were undertaken in a very accessible way, and how members of the public made a difference to those projects. So you can see on the screen, this one is the fellowship application I was talking about earlier, so that's animated me, you can see. And then alongside the animations, we developed some information sheets, and these sheets are more for researchers who want to know more. So they go into a bit more detail about what worked well, what we'd do differently next time, what were our top tips, how did we go about organising the meeting? Because from the survey, we found that the researchers really wanted detail not only on how members of the public had impacted a project, but also on the sort of logistical aspects as well. So you can scan the QR code. We have a few case studies now on our website, but we are hoping to grow those going forwards. Our PPI members said that they really liked the lay summary glossaries on the NIHR website that give accessible definitions for research terms, but they didn't really include the sorts of terms we used in statistical methodology research. So they suggested developing a new glossary which focused on these statistical terms. So we spent quite a long time working with our PPI group to work out what level these definitions needed to be at. We developed a set of different levels of definition and then presented them to the group, and they chose the level that they felt was most appropriate. And then we've worked with them to develop now a list of around 60 definitions. And again, this is freely available on our website. Now, one thing we realised as we were developing these is that there's only so lay some of these definitions are going to be in terms of something that you can write in a couple of sentences. So what we're doing now is developing some visualizations that go along with the lay definitions to help the understanding of the terms included. So once they're available, they will also be included on our website. So it was really great undertaking this PPI work with our PPI-SMART group. We learned a hell of a lot from them, and they really helped us drive forward this programme of work and the resources that we've developed. But we started to think a bit more widely. So our PPI-SMART group, they're a highly skilled group of public contributors, which has been great for the work that we've wanted to undertake. But we were wondering how people got to know what PPI is and how people get involved in the first place. We wanted to understand more about our sort of local communities. So our PPI-SMART group is a national group. We've literally recruited members from all corners of the UK. So we wanted to go out into our local community. We felt that PPI can feel quite one way. So it's us wanting to get advice on our projects from members of the public. How do we give back? Was there something we could do? We wondered about increasing public understanding of what we do as statisticians. And we wanted to sort of continue to develop our communication skills. So we're really lucky at Leicester. We have the Centre for Ethnic Health Research, and also we have a funded NIHR Biomedical Research Centre. And through that BRC funding, we have access to a community engagement officer for a day a week. And our community engagement officer introduced us to community engagement. So this has been a really novel and new thing for all of the biostats groups. So this is where we go out to existing community groups who meet on a regular basis. Generally, these groups, they don't know what PPI is. They usually don't know, other than we're people that work at the university, what type of work we do. And we go to groups, we introduce them to a craft activity, and we just start having conversations with people. And this has been really valuable. We've really developed our communication in terms of talking to a wide range of different people. And also we've got to know what's important to the people in our local communities, and how the work that we do might make a difference for them. So our craft by number sessions are going really well. We've been to 6 groups so far, all of which are very different. We're now starting to go back to the groups that we've already been to with a new craft activity and further developing those relationships, but also continuing to access new groups. So I said at the start that when I had a look to try and find examples where other statisticians had undertaken PPI, I kind of struggled. And I think some of the problem is there are examples out there, but they're in quite diverse sources. So some people publish their PPI activities as research papers. That's something we've tried to do. Some people have blogs or university websites which host the information. Some of it's in YouTube videos. And we wanted to develop somewhere where statisticians could come together to share resources and learn from one another. And so a group of us have developed a community of practice for statisticians around PPI. So we have a LinkedIn page, which is our main way of sort of sharing resources. So please do join our LinkedIn site, and please share your experiences and any resources you develop on there. We also have a seminar series. So we're coming to the end of this year's list of seminars. We've got one left to go next week, which is looking at PPI to inform methodological research in terms of evidence synthesis. And that's really interesting because Ruth has been involved in both children and adults in her work. But all of the previous seminars are recorded and they're on the LinkedIn page. So they are there, so you can go and have a look at those. We're also really pleased that we've been awarded an MLC grant around developing guidance on how to do impactful PPI for statistical methodology research. So this grant started in June and will run for 2 years. We're currently undertaking a scoping review to try and bring together the evidence base as it stands to date. But we're also doing extensive qualitative research, which is really new to me and I'm finding very exciting. So we're going to be undertaking observation of PPI groups in practice, interviewing PPI and statisticians about their experiences, developing our guidance, and then we'll be holding some World Cafe events at the end to refine that guidance. So keep your eyes peeled for outputs from this piece of work. So I'm just going to end with some reflections, really. I think what I've realised during this time period, which has probably been about 2 years now since I applied for the Research Professor Award, is PPI isn't something that we do as part of our day job as statisticians and methodologists. We do it when we've got this really scary grant application to put in, and quite often they're fellowships when you're a statistician and a methodologist. And so you're in a high anxiety time anyway, and then you throw in doing PPI. I think if we try to make PPI part of our day job, sort of changing the culture of how we work as methodologists, that will improve the PPI we do. And then when we come to those fellowship applications, you know, the mystique has been taken away. And we might have already done some PPI that we can use within those applications. I would say there is support out there. So try and find that support and then use it. So the NIHR do fund a lot of PPI infrastructure through biomedical research centres, through the ARCs, through the Research Support Service. So try and find locally who's there that can help support you. I would say never run a meeting on your own. I think that's really challenging, particularly now lots of meetings take place online. You're trying to make notes, you're trying to remember what you need to cover, you're trying to make sure that everyone's spoken. Facilitating skills aren't something as a statistician I've been trained in. So I think it is a skill. So having someone there, maybe a PPI coordinator who could maybe chair the meeting so you can concentrate on the science, I found really helpful. Our community engagement activities have really developed my confidence in terms of talking to members of the public. So I would definitely urge you to get involved in any sort of outreach activities, even if they're not about your research per se. I think they're a really useful thing to do. I've really enjoyed having the opportunity to use more creative methods within my work. As a statistician, I don't get a lot of use out of felt tips or Pritt sticks, but actually being able to do something a bit more creative is something I've really enjoyed. One of the things that I used to be really worried about, and particularly when I did the PPI for my fellowship application, was I didn't know what I wanted from the PPI group. I couldn't see how they could help me. And actually one of the members said to me, Laura, your job is to come and tell us about your project in a way we can understand, tell us what you're trying to achieve, and we'll tell you how we can help you. And that just really changed everything for me. And I thought, well, that seems obvious now, of course. So I think having that mindset when you go into a meeting can really open up what happens when you get there. And in my experience, you can never predict what's going to come out of a meeting. And if you could predict, what would be the point of having the meeting? Every time I've conducted any PPI, the comments or the feedback that I get has always been something I've not expected. They pick up on those blind spots that you hadn't thought about. I have found reading about the experience of others has really helped. So I'd urge you, if you have undertaken some PPI, to share it with other people, share how that went. And I think actually embedding PPI and community engagement into your sort of day job as a methodologist has actually improved all areas of my work. So particularly in terms of speaking in accessible ways. I think we all slip into sort of jargon and acronyms. So that's really helped. But also, there's nothing like having to explain your project to someone who knows nothing about it to make you really understand what you're trying to do and what you're trying to achieve. Sometimes it just makes you take that step back and you realise that maybe you don't understand what you're doing or why you're doing it as much as you thought. So it really sort of consolidates in your mind the importance of the work that you're doing and why you're doing it, because you need that to be able to explain it to someone else. So I would say that that's really helped as well. So this is just a quote from a public contributor that I've worked with previously that I really like. I like the fact that as a public contributor, Derek really sees the importance of methods research. And I think there's definitely a place for public contributors in terms of contributing to taking that research forward. Thank you. I'll stop sharing.
Thank you so much, Laura. That was such an insightful presentation, and thank you for taking us all on your journey with PPI. Just a fascinating and some really wonderful approaches and resources there. So I think the work that you and the PPI-SMART group have done, it's clearly addressing a critical gap that how we approach methodology research. And I love that it's that sort of consolidation and sort of it makes it all meaningful all the way through. And I'm sure many of us are now sitting in the audience sort of reflecting on our own experiences with PPI and methodological research, and perhaps recognising some opportunities, and we'll all be galvanised and excited to go off and do some of the inspiring approaches that you've shared with us today. So we do have some time for questions and discussion, and I'd encourage everyone to use the Q&A function to submit your questions. And please do use the thumbs up to upvote questions that you'd like answered. And while we wait for some questions to come in, I'm going to start with a few thoughts that struck me during your talk, Laura, if that's all right. So I think sort of you mentioned, that's in the initial survey, 79% of statisticians in the survey hadn't undertaken PPI for methodology research, but clearly sort of saw the value in it, and many just lacked confidence, which I think, in the word cloud earlier, our largest words were difficult, challenging, complicated in nature, and when thinking about PPI. And our work. So for somebody in our audience today who has been inspired to try this but doesn't know where to start, perhaps they're working on a statistical methods project right now, what would be your sort of two practical first steps? Are there particular aspects of methods research where PPI involvement tends to be more straightforward to begin with?
Yeah. So two things I think people could do. So I think, first of all, try and find out if there's PPI infrastructure at your institution that you can access. That would be my first tip. So both our ARC and our BRC have PPI groups and community engagement events that run regularly. So our BRC does something called Dance and Health, where they have a regular dance class, which is then followed by refreshments, and members of staff can go and talk about their projects. And that's a great way because you haven't got to set up a group. You might have to dance. It's Bollywood dancing that they undertake because we're based in Leicester. But that's a ready set up group. It's a really relaxed environment where you can just go and have a go. So that would be my first tip, to try and find out what exists already. Or is there colleagues in your institute that are undertaking PPI for applied research projects that you could go along to? We did some shadowing at Leicester, and that just helped to take the mystique away a little bit. You could see how groups were run, how people chaired them, how they made sure that everyone spoke, how they described their research, because even applied health research can be complex. So you get to see other people in practice. So I would try and find help within your institute and try and find some PPI groups you can go along to and sort of observe, would be my two tips.
Fantastic. I mean, just such a great sort of way to reach people. I want to come along to the dancing session. Dance for Health. That sounds great. I really like these sort of less, I guess, conventional approaches in a sort of meaningful way to actually go out into communities and reach with people. And your community engagement work within Leicester, it just looks so fascinating. And just that shift from that sort of more traditional, let's have a meeting, and typically now let's have an online meeting. as well. There's a lot to be said about going out into communities and doing some sort of outreach and engagement that way. How do you sort of find that balance, though, in sort of going out and galvanizing sort of the community voice with more the voices from your PPI-SMART group? Sometimes we get sort of different priorities and advice and sort of direction from people, and trying to find that balance can be tricky for us.
Yeah, so I would say that the two activities currently are meeting different needs. So I think when we started the community engagement, I thought we would be going and we'd be talking about our research and we'd be getting feedback. Actually, these groups, they don't even know what PPI is. You know, some of them don't know what research is. They know that we're a group that's come from the university. So it's really, really early conversations, but actually really important conversations. So we went to a hard of hearing group, and actually some of the people at the group were deaf. We took a signer interpreter with us. I don't know why I'm doing that. That's not what she did. And that was really fascinating. And they were telling us how they feel just excluded from research completely, and people don't come and talk to them. And it really stuck with me. And then I was in a trial steering committee for a trial that I work on, and they were presenting some data on who had been screened, and someone who was blind had been excluded. And I perhaps wouldn't have thought about it before, but what the deaf group had said to me really stuck with me. And so I said, well, actually, that's not an exclusion criteria. Why is that person not being considered for the trial? Were they asked and they declined, or have you just not approached them because they're blind? And actually it was, they hadn't been approached. So sometimes I think just talking to groups, understanding what their challenges are, feeds into what you do in a way you don't expect. So currently our community engagement, I'm getting a lot from it in terms of my confidence, developing my skills. I think the groups are getting something from it because they enjoy the craft activity, they enjoy learning about what we do. And actually, when we go back to groups we've already been to, we might push that relationship along further towards PPI. And maybe a couple of people from all of the groups we've been to may then take up a PPI opportunity. But it's about that pipeline of how people get to know about research. Or it might mean that when someone's asked about being a participant in research, they're more likely to say yes. But it's not about immediate gain for us in terms of feedback on our research at the minute. Does that make sense?
Very much so. So a lot of my own work, I do sort of involvement with people living with dementia, you know, who have various communication and cognition issues and things. And it's really about making sure that you take all those sort of inclusive approaches and all the reasonable adjustments that you can to sort of just have a conversation with somebody. And I think that sort of directly leads into one of our questions that we have coming in on the Q&A. So Thomas has asked, how do you deliver information to people with, say, varying reading ages, or perhaps don't have English as a first language?
Yeah, so I think in terms of reading ages, I think if you can move away from things that you're wanting people to read, I think that's really helpful. I think having a conversation is far more powerful. So if you can talk to people about your work, and I would say, I think sometimes as statisticians, we get caught up in the technicalities, whereas actually if you can take a step back and if you can try and get across the concept of what you're doing and why it's important, what difference that will make, I think that's the best starting point. And it might be that some people in the group want more detail and they want those technicalities, but some people will feel that they can help without knowing that level of detail. So I think that would be my first thing. I think using analogies is really helpful. So in our animation, we talk about the right tool for the right job, how you wouldn't use a teaspoon to dig a hole in your garden. It would take too long, it's inefficient. But equally, if you used a big digger, it might have unintended consequences and it might ruin the plants around the hole. So I think if you can use sort of storytelling techniques, that really helps get the message across. In terms of the written word, there are, so the NIHR has a great readability tool, but you will find you spend hours trying to think about how to say things in smaller words and in small sentences. And I think there is a balance between accessible and patronizing. That's a fine line, I think. So I think if you do need to develop something that's written down, I think working with PPI groups is a great way to develop those written documents. So that's a great way to work with a group. You know, what of this makes sense? What do I need to think about completely changing? And also I would always think about costing in, if you're costing for your PPI, translators, interpreters, whatever it is that you're going to need to be able to access a diverse voice. Yeah, so they would be my tips.
Yeah, I think it's about sort of factoring those costs from the very beginning, even if you don't really know what exactly it is that you want to produce, which kind of sort of, I think you've maybe sort of touched on a question that came in from Fran, which was, she sort of asked that directly, how much did it cost to produce some of the resources you shared with us today? So the animation and the, I'm guessing the summary documents as well.
Yeah, so we've been working with a company called Nifty Fox, who are brilliant. So Laura, who runs Nifty Fox, started as an academic, as a social scientist, and they work a lot with the NIHR. So they know a lot about PPI, they know a lot about delivering complex messages in an accessible way. And actually, the thing I really like about them is that all their prices are on their website. So you can go and you can see how much all of these things would cost you. There's nothing worse than when, I always think it's a bit off-putting when you've got to email to try and find out how much something will cost, and then the price comes back and you're like, yeah, no way. So they're really good. I mean, I'm sure there are other companies, but that's who we have worked with. And I always dread saying their name out loud because they keep getting busier, but they are a really good company to work with.
Thank you. That's some great advice. And sometimes there's sort of services within our own sort of organizations or institutions as well that we can have access. And until you look, you don't sort of realize that they're out there and they can help.
Well, the designer that we're working with for the visualizations to go along with the glossary, that's someone that was already employed at the university that was able to take that work on that we didn't know existed beforehand. So I think sometimes it is about trying to find out what is available to you locally.
Great, thank you. So we have another question here, which is, it's much more about sort of how we, I guess, evaluate and demonstrate impact. And it's about sort of the question is how do we best evidence to funders, say like the NIHR, that the impact of PPI on design and outcomes, and not just coming up with the topic or research question itself.
So I don't think you'll need to persuade people, NIHR panels, of the importance of PPI for methods work. And I've never known a fellowship to come back saying, oh, you've costed in too much PPI. It's always the opposite. So I don't think that's a worry in terms of the NIHR. I think the question around impact and evaluation is something we're starting to think about. So we've made these resources. We think they're really good. We're using them, but how do we demonstrate that they do make a difference? And I would say I've got no easy answer for that, but it is something that we are starting to sort of think about how we can capture. I think we can see the difference that it makes to the projects that we do where we get PPI involvement. because changes get made to the projects that make them better. But I think evidencing that impact of the resources that we've developed, I think that is a challenge. And that is something, if anybody knows a lot about that, please email me, because I'd love to know more about how we go about evidencing that impact, which is important to our institution. Yeah,
it's a good question out there, and of course there's the more available frameworks and for assessing the impact of PPI in research, such as the GRIP tool and PRIT and things. And I think just keep a log. I think from my own experience, either how PPI has helped you refine, improve your methodological approach. Just keep a log as you go through to be able to capture all those moments where that involvement has really come on board and helped change and improve our practice. So I've got a question here from Nicolette, who's asking, how do you effectively combine your professional knowledge of statistics with that public opinion and input? How do you decide on the best statistical methodology if the two don't align, the two don't match?
That's a good question. So sometimes I hear people say to me in my group and wider, well, they have this feeling that they have to take on board everything a public contributor says or a PPI group suggests. And I would say if they are an active member of the research group, we have a conversation like we would with any collaborator, because there's always more than one way to do things. And quite often between collaborators, there's different thoughts on how we should go about things. So I think it's about, you don't have to agree to everything. But I think the things that are suggested you can see that they would definitely make a difference. It's about taking those on board and feeding back to the group that you've taken those on board. There's some things which it might be lovely to do, but are out of the scope. And again, I think it's explaining that, that's a really good idea, but because of X, Y, and Z, we're unable to do it. And then there are maybe some suggestions that you just can't take on board. And again, I think it's about having that conversation and not being scared. I think it is a conversation and people are suggesting things, but they are suggestions. So I think like any other collaborator, it's, using those skills that you would in any other conversation. But I think definitely feeding back what you have taken on board is really important, because lots of PPI groups have said to us, people come, we give them advice and then we never hear from them again. And I don't think that's a problem just in methodology. I think that's a problem across the board. But I think the important thing is explaining why you've been able to take some things on board and explaining why you haven't been able to take other things.
Yeah, that's a good approach. And we have to take a very pragmatic stance. Sometimes we're limited by, the constraints of time and money as well. But we can always go back and revisit good ideas for in future work. I think that's important as well. So I think we've got time for one final question. It's a biggie. But on the Q&A here, we've got Laura, I love what you've done, but how do you feel this work has enabled you to engage with vulnerable or harder to reach groups out there as well? So I guess that leads into your community work.
Yeah, and I think so. Our PPI group are fantastic and brilliant. And they're very diverse in their characteristics, but they're not very diverse in terms of their PPI experience, because we purposefully recruited people that had that experience, because that's what we needed. We needed their help. We needed them to guide us. And so that is something that we've been reflecting on and why we started the community engagement. Again, I think it's about understanding your local community, what that looks like, who are the groups that you might want to work with, And again, trying to identify people that can help you access those groups. So Gurpreet, our Community Engagement Officer from the Centre for Ethnic Health Research, is amazing. She's got so many connections. Her job is about making connections. And yeah, I don't know how far, I don't even know how you go about learning about which community groups exist other than having a Google, whereas Gurpreet does, and she knows how to identify those groups. She knows who to talk to, how to set those sessions up. So I think, again, it's about finding those people that can help you access those groups and not being scared to go to them. So we've been to groups that don't speak English, that can't hear. We've been to groups that are very, I would say, emotionally vulnerable. So we went to a cancer survivors group, and one thing we all are scared of is someone crying at a PPI event and has not known what to do about it, because we're not used to dealing with members of the public and triggering situations. But actually, you know, just by going to these events, you kind of learn how to deal with these things, which is, again, I think, a good thing that improves the whole of your work life.
Yeah. Thank you so much, Laura. So we're coming to time now, and I just want to thank you for sharing so much and such an engaging and really inspiring presentation as well. I'm going to be going off and looking at all the resources that have been developed and thinking how I can apply that in my own work. And I think many of us will be looking at those as well. So thank you for sharing. And thank you all for your questions and participation today. Lottie, can I ask you to wrap up for us, please?
Hello, thank you, Jane. Hopefully, yes, you can see my screen. Thank you so much, Jane, for chairing that Q&A. There were so many questions there. There was a lot of people joining us today. And thank you, Laura, for such a fascinating and interesting and insightful session. I put a couple of links throughout the last half an hour to our feedback form. As I said, this was our first few episodes in our new seminar series, and we're going to be launching a new longer series in January next year. So we'd really be keen to hear from you. If you've got any ideas on other topics you want us to cover, then please also get in touch with us. We want to do more and better, cover a wider range of topics. Anyway, thank you all. And just remember that we are here to we're here to support researchers at any career stage to develop funding applications for health, public health and social care research. So thank you everybody for joining us, and I'll keep sharing my slides, but thank you. Thanks, Jane. Thanks, Laura.